This is funny. So we've gotten a little less, tight on the medical heavy duty stuff, and we are totally going to shift gear. And we're going to have a paired set of talks that are going to focus on the impact of social media in gynecologic cancer treatment and survivorship. So we're actually going to be hearing from Jill Holdren, who is a advocate a patient advocate for both ovarian cancer patients and also patients with hereditary cancer syndromes. So for those of you that don't really know what a patient advocate is, it's somebody who advocates for patient rights and is sort of a voice in important conversations that is a representative basically from the other side of the equation to help physicians get a good understanding of all of the things that might be important to patients, because sometimes we don't have that perspective. And then we'll be hearing from a physician, and I'll introduce her before her talk. So with that, I will yield to Jill, and let's hear the patient perspective. Thank you so much.
Hi, well, good afternoon. It is a real privilege to be here talking today to all of you, and thank you for inviting me. It's a little bit intimidating to be the only non-MD talking here today, but so it goes. I was asked to come here today to talk about the impact of social media on GYN cancer treatment and survivorship. And specifically, I'm going to be talking about the benefits, risks, and opportunities of peer support on social media for people navigating GYN and other cancers. And I just wanted to give you a little, okay. Why is this not forwarding? Okay, there we go. I wanted to give you a little agenda for today's talk. First, I'm going to start by talking about the potential benefits of peer-to-peer support on social media in navigating cancer and survivorship, and why people seek it in the first place. And as a corollary to that, why people in the clinical and research arena should care about the ways in which patients are convening in communities on social media. Then I'm going to talk about the ways in which participation in peer support on social media presents, on the one hand, opportunities for good data sharing, and on the other hand, the very real risk of bad and exploitative data sharing, as well as exposure to misinformation and disinformation. And finally, I'm going to talk about how we can increase benefits and lower risks by building better digital rights for patients and patient communities on social media, and formalizing and equalizing partnerships between patient communities on social media and clinicians, researchers, and healthcare institutions. And so I want to start by giving a very brief overview of my own cancer journey and how that led me to social media and to the work that I now do. For as long as I can remember, I was aware that breast cancer was very possibly in my future. I grew up knowing that my dad's mother had died young before I was born of breast cancer, and I knew that her mother too had died young of what we thought was breast cancer, but turns out was ovarian cancer. But because of a series of providers who were not educated about hereditary cancer, because of the exorbitant price of genetic testing before 2013, and because of very small family size and paternal inheritance of my BRCA1 mutation, such that I didn't qualify for insurance coverage of genetic testing, I didn't know that I carried this mutation that would have such a big impact on my life until I already had developed ovarian cancer. And traditionally in our culture, at least, people have navigated their experiences with cancer, I think, largely on their own, with at best help from immediate family and their closest friends. And over the past several decades, in-person support groups became more prevalent and accessible, at least in big enough places geographically. Today, though, tens, if not hundreds of millions of people seek information and support in focused patient groups online, largely on Facebook, although there are lots of other patient community-focused platforms, and there are a lot of people now on Instagram, Twitter, and TikTok sharing information about their patient journeys. Early on in my process of learning that I carried a BRCA mutation and that I had ovarian cancer, I went to an in-person support group where the members encouraged me to join some of the cancer peer groups on Facebook in order to get exposure to a larger number of people who were facing the same issues I was, and so I did. This is just a snapshot of just a few of the ovarian cancer, breast cancer, hereditary groups on social media. There are thousands more, I'm sure. There are groups that are available in different languages in different countries. These are many of the ones that I belong to. And some of them are focused on specific data issues. Some are focused on risk-reducing mastectomy for hereditary cancer. Others are on ovarian cancer survivorship. Obviously for virtually any community, there exists a rich constellation of online peer communities on Facebook and elsewhere. And I think most of us who have experienced cancer know why these communities form, how wonderful it is to find other people going through the same thing, to know that we're not alone, and to share information and support. And it was the information and community I found in other people who are experiencing the same or similar challenges that not only helped me to face navigating hereditary cancer and ovarian cancer diagnosis, but also to find my place as an advocate. And so, even though I knew why I found these peer-to-peer groups so helpful, as part of a Robert Wood Johnson Foundation funded project with colleagues Andrea Downing and Bob Cook-Deegan in 2019, we decided to ask this question directly to participants in 6 online cancer support groups. We surveyed nearly 300 people and interviewed 20. And by the way, a paper based on this study is coming out this year, finally. And the 2 primary reasons people gave were exactly in line with why I had joined groups myself, and that was to obtain and share information about conditions and treatments and side effects and so on, and to connect with others experiencing the same things.
Jill,
and so I think it's really important.
Your connection's pretty crackly. I don't know if you can adjust your distance from the microphone, maybe.
Oh, okay.
Sorry.
Sorry about that. So while the formal healthcare system obviously plays an absolutely critical role in providing care to people with cancer, it's just as clear that it's not able to provide the level of information and support that many people with cancer require to make decisions, understand their conditions, cope with pain and treatment side effects, and manage the psychosocial impacts of their disease. Can you hear me better now?
Way better. Thank you so much.
Okay, thanks. So here's a quote that I particularly like from one of our interviews. I was at one of the premier hospitals for BRCA care in the world, but had I not been on online BRCA support groups, I wouldn't have learned a few years ago that it was possible to get direct to implant surgery, and I wouldn't have known that salpingectomy was a thing. My physicians at my top hospital were not bringing these options up. Participation in these groups teaches you to advocate for yourself. This is a pretty powerful statement, I think. Sorry. So there are a number of potential benefits of peer support that have actually been looked at and discussed in the literature. One of them is the ability to crowdsource information. In the case of rare diseases where little research has been done and patient numbers are small, patients or their caregivers desperate to understand their conditions often are able to learn far more from crowdsourcing information of groups of others who share their experience than they can from providers or published research. Many of these patients have already fallen through the cracks of the medical system, and meeting other people who are going through the same thing can be incredibly helpful in figuring out what's going on and what next steps to take and where the experts in the field are. But even in the case of more well-studied conditions like many GYN cancers, a single provider may not have witnessed the full spectrum of disease manifestation, treatment side effects, or complications, or even, especially outside of bigger teaching hospitals, to be abreast of all of the current research. In a peer support group of thousands, the likelihood is that there are both people who've experienced something similar and people who are aware of the latest research and are willing to share that information. Moreover, there are important differences between the lived experience of a condition and the experience of being in the best, most knowledgeable healthcare provider for people with that condition. When facing health challenges, access to both of these kinds of expertise can be critical. Also, when people are diagnosed with a life-changing condition like cancer or hereditary cancer mutation, their need for information and support can be intensive for a significant period of time. They may see their provider every few weeks or few months, but as they navigate questions of surveillance, surgeries, treatments, and so on, they may feel the need to engage daily with a community that can provide both answers and support. Another really interesting thing that we've seen is that online patient communities whose memberships often number in the thousands or even tens of thousands also can offer a democratization of information where people seeing providers at the best hospitals in the world can share resources, research, treatment protocols with people who may be in rural or other underserved parts of the globe. Research has also shown that participation in peer support communities can empower people to feel agency over their health and healthcare. It can increase people's health literacy and knowledge, and can provide the opportunity to collectively organize as a community to partner with healthcare research institutions or to affect change on something important to the community. And obviously, I mean, all of these depend on being in a peer support group where it's evidence-based and well-run and so on and so forth. Here are a few more quotes that I won't read out loud, but I'll just give you a minute to look at them. I think the quotes from our interviews and surveys were the most wonderful thing about our study, and gave just a lot of insight into what these groups are all about. So then the question arises of why clinicians and researchers and the healthcare enterprise more broadly should care about peer support on social media. And the first reason to care in my mind, is because that's where the patients are. We know that tens of millions of people are convening around health challenges online every day, including people in all sorts of different cancer communities. Secondly, for better or worse, that's where many people with cancer are getting a lot of their information. As I alluded to earlier, many people we spoke with in our study are getting almost all of their information other than what they get from their occasional provider visits from their groups. And as of all of us who have spent time on social media in general know, depending on the group, this can be good or bad news. There's also evidence that participation in well-done groups can increase people's understanding and knowledge about their conditions. And the reason why that matters is obvious. And research suggests also that more engaged patients have lower healthcare costs, which is one of the reasons why healthcare institutions, I think, should know that this is happening and start thinking about ways to partner support it. Also, online peer groups face a variety of challenges and they need help from other parts of the healthcare system. As I've already mentioned, it's in the interest of the formalized medical system that groups function well, that they protect people's data, and that they share evidence-based information. Groups also are, as I mentioned, organized communities, sometimes the biggest communities of a given patient group anywhere, and they're ripe for ethical partnerships with researchers and healthcare institutions. And finally, as we talked about earlier, groups have the capacity to democratize, to at least some extent, access to high quality information, which ultimately I think is something that benefits all of us. And so, as I mentioned at the beginning of the talk, in addition to the potential benefits of participation in peer groups to individuals, communities, and to the formal healthcare system, participation in social media presents both an opportunity for the kind of good data sharing that can result in improved outcomes for people with cancer, and the very real risks associated with bad or exploitative data sharing, as well as exposure to misinformation and disinformation. And first, I want to talk briefly about the good kind of data sharing. As we all know here, good data sharing can lead to important advances in prevention and treatment of cancer. As a member of a community with a genetic predisposition to disease and someone who's had cancer, I am super aware of the need for data, lots of it, unsiloed and easily aggregated to get the answers our community needs in order to have better options for screening, prevention, and treatment. And this is just some of the questions that in my community we're asking and don't really know the answers to, except for the drink less wine. I think we're pretty clear that we should be drinking less wine. But other than that, these are all things that require more data to answer. And we're all sort of desperate for those answers. And I think this is true in every disease community, not just cancer, and certainly not just hereditary cancer. And I'm also aware, because I'm in so many groups on social media, that there's a lot of data in these groups that could potentially help our communities get answers, or that harnessing the power of these groups through ethical partnerships with researchers could present an opportunity for progress toward better prevention and treatment options. And one of the projects that I've been involved in is this Global Alliance for Genomics and Health project, the BRC Exchange at UC Santa Cruz. And one of the things that they have done, which I am highly in favor of and think ultimately leads to much better data sharing, is they have added patient advocates from the hereditary cancer community to their governance. And they've also been working closely with the hereditary cancer community, including the online communities, for the past few years, trying to understand how they can partner effectively with these communities to improve the quality of information that's exchanged in groups, and also involve people with hereditary cancer in various aspects of the variant classification process, which is what this particular data sharing initiative is focused on. And of course, there are bazillions more examples of good data sharing. Here's just a few. Some of these initiatives are initiated by and run by communities that have historically been excluded and or harmed by research institutions. All of these kinds of initiatives certainly can be strengthened by and benefit from governance, shared governance with the patient communities that are in question. But even within the realm of good data sharing, there are standard bad practices that end up discouraging many patients from participating in research and sharing their data. One of them is that even when we participate in research, donating blood, tissue, time, we almost never see the results of that participation directly. We fill out a survey, authorize a blood or tissue sample, and never hear from the researchers again. Obviously, there are exceptions to this, and those are wonderful. But this is a problem that can and should be solved, and I don't think it's very difficult to solve it. Further diminishing trust and interest in data sharing is that when research is published based on our data, even if we come across it, we often cannot read it because it's behind a paywall. Or if we can access it, it's in complicated scientific language we can't understand. This is another problem that we need to solve, I think, if we're going to work more effectively between patient communities and researchers and clinicians. So now I wanted to talk briefly about the bad kind of data sharing. Obviously, one of the big problems with millions of patients using Facebook and other social media sites to share private health information is that the information is not in fact private. It's not protected by regulations like HIPAA or any other. And there's plenty of evidence that Facebook, as well as other social media giants, have both intentionally and unintentionally allowed third parties, some nefarious, to access this type of private information, something which puts all of those of us who use these groups, and again, there are millions of us, at risk of any number of harms, from loss of insurance and employment to ad targeting and other adverse impacts. Another type of bad data sharing is that hackers are targeting health data because they are able to sell it at a great profit to health and other types of insurance who buy it to be able to raise rates, deny coverage, or create profiles on the people whose data comprise it. 70% of employers right now are using social media to screen job candidates, which for people with cancer or even just at high risk of cancer can be bad news depending on where we work. We've also seen targeting of particular groups like Black women with breast cancer in our extended circle of this group called the LEWK Collective that I'm going to talk about in a moment, by health tech companies. And while it's really important that all groups are represented in cancer data repositories, and to date we have not done a good job at that, it's also important that especially groups that have experienced injustices, experimentation, and other forms of harm have not only the opportunity to engage in truly informed consent when participating in data sharing and research, but that they also have clear rights and an active role in the governance over how their data are used. So just briefly to talk about misinformation and disinformation, I'm sure everyone here is very familiar with this. These are two other major risks of convening on social media and looking for information there. Misinformation refers to incorrect information that's shared without malintent, but is still wrong and can lead people into trouble. Disinformation is the deliberate spreading of false information. We saw lots of both of these during the COVID pandemic, and both obviously can harm people with cancer and can cause more hassle and work for people in healthcare. And both of these can and do happen, of course, in some cancer peer support groups on social media. So I imagine many of you might be thinking the same thing that many of us in these online patient communities have been thinking for the past several years, and that is, given all this bad news, why would anyone share sensitive or private health information on social media? And the truth is, we really don't have a choice. Many people in our study talked about how they did not like the privacy risks they were taking by participating in these groups. Many even said they'd avoided going onto social media for years, but ultimately joined because they felt like they didn't have a choice. The information and support that they could get from fellow patients there was available nowhere else. And they felt like these elements were absolutely critical for their journey through cancer. But the question that I want to ask here is, should people with cancer and other serious health challenges have to make a choice between sacrificing their privacy and digital rights and getting the support and information they need as they navigate what is obviously already a very difficult journey? So what can we do about all this? How can we encourage the benefits of peer support on social media while mitigating the potential downsides? How can we harness the power of online patient communities to help drive research and answer questions that will drive scientific progress and also protect health privacy? Thanks in part to the generous support of the Robert Wood Johnson Foundation, again, a group of us, all patient advocates, formed an organization called the LEWK Collective that's been working to think about and develop solutions to these issues for the past several years. Our mission is to represent the collective rights, interests, and voices of patients and patient communities in healthcare and health technology. And our goals are here, they are to identify or create safer, more ethical online spaces for peer communities to convene, to achieve collective self-governance of our community's data with a particular emphasis on BIPOC communities having sovereignty or at least significant governance over how their data are used and shared, to assist patient communities and research healthcare institutions to establish ethical, mutually beneficial partnerships through, for example, learning health networks, and to create a framework for strong digital rights for patients and patient communities who are using health technology online. So just have a few phrases here that are words to live by in our organization and in our world of patient advocacy around these issues. The first is patients as partners, not just p-values. It's important to have patients as p-values, but it's important to have them as partners as well. I think research benefits from that. We all benefit from that. Another one is nothing about us without us, something the disability community has talked about a lot, and many other communities. If it's going to happen about us, then we should be part of the governance of how it's happening. And again, this is particularly critical for communities that have a history of being harmed. And no aggregation without representation, meaning no aggregation of our data without representation in the governance of that data. So I think the good news is that many research and healthcare establishments are starting to rethink the role of patients, understanding that they are not, nor should they be, simply passive recipients of care, but they must be educated, engaged, empowered participants, and that healthcare and research benefit from patient partnerships in myriad ways, including in ways that increase the good kind of data sharing and research participation that ultimately benefits us all. Right here in Alaska, we see manifestation of these principles. I say it here in Alaska because I lived in Alaska for a long time, and I know many of you in the conference are in Alaska. But we see these principles manifested in the Alaska Native medical system, where customer owners govern at every level how data are collected, what research is done, and so on and so forth. And I think that's a model that should be applied much more broadly. And finally, I want to end here with just special thanks to all these folks, including all of you, for inviting me and listening to me. And thanks for this opportunity.
Awesome. That was very interesting and very well delivered.